get moving here. Can I, first of all, welcome to our new year and our first or second committee meeting. Welcome, Susan.
Thank you.
Thank you. Ms. Edna, we thank you for your past commitment, and Giselle, thank you for the tone of your introductory comments on your agenda. Good morning, Ryan. Can I first of all get a motion to approve the minutes of our November 18th meeting? Supervisor Beatty, seconded by Supervisor Frazier. All those in favor?
Aye.
Giselle?
Good morning. Just to kind of reiterate what Chair McDevitt said, we do welcome back our returning committee members. We welcome back to the committee Supervisors Beatty and Conover, and we also welcome Supervisors Bruno and Scheffler. We sincerely appreciate all the support that Supervisor Frazier provided. She was our chair, and we look forward to working with Supervisor McDevitt. And we would like everybody to know that everybody's welcome to come visit the department at any time. We'd be happy to give a tour and orientation and answer any questions people might have. So with that, we'll jump into business. First is to request resolutions to reappoint members of the Warren County Health Services Professional Advisory Committee for the year of January 1st, 2020 to December 31st, 2020. For the list that was transmitted with the meeting agenda and information. This committee must be appointed annually by resolution from New York State Department of Health Regulations. A copy of the membership is available at the meeting and will be on file with the minutes. Meetings are held quarterly at the municipal committee.
I think we have a motion by Supervisor McGowan, seconded by Supervisor Conover. Any discussion? All those in favor?
Aye. The next resolution request is to appoint and reappoint members of the local radio relations coordinating council for the year of January 1st, 2020 to December 31st, 2020 for the list transmitted with the agenda. Again, this is something that we have to do annually, and there's a copy of the members with the agenda, and we'll have it on file. This committee actually meets.
Motion to that effect, Supervisor Frazier, seconded by Supervisor Beatty. Any discussion? All those in favor?
Aye.
Great.
All right, we'd like to request resolution to amend our contract with North Country Home Services to reflect an increase from $31.20 to $35 an hour. Tom wasn't with me when I told you this, but this is actually a 12.18% rate increase, so there's a little correction there. This agency provides paraprofessional services, including aid services to our patients, especially within part of the county. And at this time, we have no active patients. However, we do want to be sure there's resources in place should we need somebody.
Supervisor McGowan made the motion, seconded by Supervisor Bruno. Any discussion? Supervisor Beatty.
Yeah, so that's a fairly large increase, percentage-wise. I mean, and even dollar-wise, it's almost $4 an hour more. That wasn't your request, that was their request.
Right, we get a letter sometimes every year, sometimes not, and they, with their business structure, will tell us what the rate's going to be. I mean, we have the option to say we don't want to use you, but we really need to have that provision in place. Right now, our aids and valves may be clarified, but are predominantly covered by other agencies that are less an hour. But should we have somebody in the North Country that we can't get somebody to, we certainly want to have them. This is a company out of Saranac Lake.
Okay, so we really don't use them very often. We have other lower cost options, which makes sense to me.
We do, but they won't travel north.
But we have limitations with them. Okay, so
They'll cover up there, Stony Creek, North Creek, Johnsburg, where a lot of times the other ones don't have the availability for that.
So, for example, last year, how many times did we use them, or how many? We didn't even use them last year at all.
2019.
Oh, I'm sorry.
Yes.
We usually have like one or two patients. We're not talking a lot of volume up there at this point, but usually 1 to 2 to 3. That's why right now we don't have any, which is good. But it's just, being North Country, there's so much staff, as you know,
Yeah.
the rates have to cover their costs up there. so that's why they had to increase them.
Yeah, I'm supportive in having someone available
Yeah.
and a revenue, and an option to take care of them, obviously. I was just concerned that, you know, going up almost 14% increase, that's fairly significant. And I was just wondering if there's any way we could have said, you know, we appreciate your, is there any, could you have negotiated somewhat? I don't know, I'm just throwing that
Well,
out.
when I clarified, you know, who the contract person was and this, that, and whatever, I did try to do that.
Okay, you did.
I was told that, you know, with their cost increasing, that, and it's a smaller operation, that 0.9% of their, or I'm sorry, 90%, I'm not the numbers person, Sandra still is, that 90% of their cost goes to their employees. And then they were saying that the overhead cost was increasing, so that's why they justified the rate, and I didn't really have a lot of opportunity to.
Yeah.
The other thing that they wanted to do was push us to have to do more than, because normally it's 1 hour, and they were saying it's not worth it to them without this increase, even if that's the case. They prefer 2 hours or above.
So, are they still willing to do 1 hour, or?
They are doing 1 hour.
Okay, all right, so they didn't increase the minimum amount of time, which, so they rationalized,
Yeah.
because of that, we're gonna need, because it's short, could be only 1 hour. Okay, now that makes some sense to me from a business standpoint. Okay, all right, thank you, I appreciate the input.
Thank you. Bruno,
Why does
Supervisor.
the, states here the rate increase 31.20 to 35, but in the resolution request form 4, attachment 8, under the payment provision says hourly rate amount is $35.50.
That's on page 8. The attachment 8.
Good catch there, newbie.
So is it 35 or
It is 35.50, which is probably why we put 13.78 tonight.
There you go.
I was,
Thank-
trying to cut it down just a little bit, but it is, their letter states 35.50. So did they put in the actual resolution itself? So yes, the resolution form is right, but no, right after the stop.
So I'm sorry?
So it is 35.50.
Okay, so is that percentage increase based on the 35.50, or I don't have a calculator?
I like this, this,
Hold on,
Yeah.
Ron's ready, got it.
Come on, everybody's got a phone.
Okay,
Gotta have that calculator ready.
have we moved off the high finance there? Are we all set? Ryan, did you have a question?
What are paraprofessional services?
They're home health aides to assist the patients with personal care, range of motion exercises, bathing, toileting,
Okay,
dressing.
thank you.
13.78, so the percentage was right. That was wrong. So we did right.
Thank you.
So it's 13.50, 13.78, okay.
Yeah.
And they're still willing to do just an hour at a shot?
Yep.
Okay.
Thank you. So we have a motion and a second on the floor. All those in favor?
Aye.
Moving forward, Janelle.
The next three are personnel related. The resolution request referral to the Personnel Committee to approve filling a vacant public health nurse position. The base salary is $50,816. The intent to fill is attachment number 9. The intent to fill expires December, and we need to extend it in order to fill the position, and I think we have viable candidates, so we'd like to move that forward.
We get a motion, Supervisor Conover,
Yeah,
second
I'd
by
like to move
Supervisor...
I'd like to move both public health, filling both public health nurse positions.
Could we get a motion to that effect? Supervisor McGowan, seconded by Supervisor Bruno. Any discussion? Supervisor
Just,
Conover.
how much difficulty are you having finding nurses? Maybe that's an easy, slow pitch. Maybe, what are your expectations of filling these positions?
It's very difficult to fill the position, and a lot has to do with the amount of pay. We are probably one of the lowest paying for home care services than any of the others in our surroundings. So a lot of people to come here, where our options are, we hire a brand new nurse, which we've hired probably 4 of them in the last year. 2 of them seem to be working out. The other 2, once, you know, they got into it, they were like, no, this isn't for me, because people think they take care of patients at home, you know, you're in their own home. It's not, you know, running around like what they have to do in the hospital setting, et cetera. But the things that the nurses have to do at home, you know, you don't have somebody, you have to have, you know, good assessment skills and stuff like that to be able to realize when patients are running into problems, stuff like that. And computers, you know, is difficult, and our regulations that we have in home care are, they're very stringent and tough, so it's hard to get somebody to come in with any type of an experience and then to, you know, what the pay rate is.
Supervisor Conover.
Yeah, I hope, should you have difficulty filling these positions, you'll be back to the chairman, Supervisor McDivitt, in short order. That's a fundamental problem, because your per diem isn't gonna, I mean, you're getting some relief now out of your per diem, correct? But I don't know if the per diem's going to be able to haul this much water. I don't know, this much time, but...
Our amount of per diems has gone down as well.
I think you bring up a good point, Supervisor Conover, in that we have to be attentive and responsive to, you know, to dollars and cents in terms of filling critical positions. So.
As I remember, my memory, we adjusted the nurse positions at least once before because of this issue.
Okay, thank you. We have a motion and a second on 2 resolutions. All those in favor?
Aye.
Moving forward, you know.
Great. The next resolution request is to request referral to the Personnel Committee to approve filling the vacant part-time, not to exceed 20 hours, infant feeding advocate position for WIC. The salary is $28,026, prorated to $13.47 an hour. This position is vacant due to a resignation in December. This position is required, strongly recommended by the WIC grant, and is also fully reimbursable by the grant.
Wonderful. So, motion made by Supervisor Beatty, seconded by Supervisor Shepler. Any discussion? All those in favor?
Aye.
Moving forward.
All right, this next resolution request is kind of exciting. Dan doesn't see a lot of work, but it's to accept the 2019-2021 Community Health Assessment and Community Health Improvement Plan. Quite large attachments that went out that were posted for supervisors. Public Health is required to submit a Community Health Assessment, Community Health Improvement Plan to the New York State Department of Health every 3 years. This plan is developed through collaboration with community agencies and stakeholders, and also a review of community health assessment data. The 2019-2021 plan focus areas, typically you identify 2 focus areas. The first one is preventing chronic disease and promoting well-being. The second is preventing mental and substance abuse disorders. Dan Durkee, who's our senior health educator, and he happens to be our community health assessment, community health improvement plan expert, was very instrumental in this project. He did a phenomenal job, submitted on time. But we'd also like to thank Supervisor Driscoll, who actively participated in our stakeholder meetings, which were utilized to identify our priorities.
Wonderful. Can I get a motion to that effect? Supervisor Frazier, seconded by Supervisor Bruno. Any discussion? All those in favor?
Aye.
The next resolution request is to amend the contract with New York State Department of Health, Women, Infant, and Children to reflect intent to continue for a 2-year extension not to exceed $1,148,256. The WIC grant is a beneficial program to our participants, providing very valuable nutrition education and supplementation to our program eligible families.
Motion to that effect, please. Supervisor Conover, seconded by Supervisor Shepler. Any discussion? All those in favor?
Aye.
Forward.
We'd like to request resolution to enter or re-enter a contract with the New York State Department of Health to accept a 5-year Children and Youth with Special Health Care Needs Program grant. that goes from October 1st, 2020 to September 30th, 2025 with an annual funding anticipated of $23,088, not to exceed $125,000 for the 5 years. Our department has had this grant for many years. It's beneficial to families that have children with special needs. The current grant is actually 19,041 a year, and that one ends with September. The new grant has a slight increase of a little over $4,000 a year for program staffing, which is already in place, but certainly this funding will help offset our expenses.
A motion made by Supervisor McGowan, seconded by Supervisor Conover. Any discussion? All those in favor?
Aye.
So I'm going to let Todd do the next three, because they're budget related, to amend budget. Huh?
Attachment 16 is, our field goods program where, no, I take that back. 16 is our health education with, oh no, it is our field goods program, sorry. For $3,000 back in the fall, we did mention we were gonna get additional funds, and the treasurer's office did put that in our deferred revenue account. So now each year, because we're gonna be using it, I have to move it. We're moving, $2,950 into, this is where they buy fresh foods and vegetables, and the products are going to the WIC, families. They work that out with them on a weekly basis. They're getting food, and then about $50 for supplies that we need to do brochures or flyers or whatever they need, recipe cards, so they know what to do with those foods. So that's just moving the money out of the deferred revenue and into our revenue account and our expense account, which is all done within our health education program.
Great. Motion made by Supervisor McGowan, seconded by Supervisor Shepler. Any discussion? All those in favor?
Aye.
Attachment 17 is our, again, funds that we additionally have for our district program, which is New York State Delivery Systems Reform, which we get from the Adirondack Health Institute. We have funds that, again, are in the deferred revenue account. Again, we want to move them over so we can use them this year. So we're doing that at the beginning of the year. We're moving over $40,000 this year, hoping to use that towards any equipment that we're going to need. Is primarily working towards the goals for our home care, and is getting, if we need some office equipment, some supplies we may need, data processing to work towards bettering outcomes for patients. So this is just, again, moving it from the deferred revenue over to our expense and revenue lines in our home care program.
Great. Thank you, Tom. We have a motion by Supervisor Beatty, seconded by Supervisor Frazier. Any discussion? All those in favor?
Aye.
Okay. Well, attachment 18 is a resolution to amend the budget for our preschool program, which we were just notified the first week in January. To give you an idea, our preschool program, which is for disabled children, ages 3 to 5, we have a particular vendor in this case, but I did round it a little bit too for other vendors that we deal with. They can give us an interim rate that they're going to bill us at for each child for tuition. I have said before that tuition for one particular vendor is like $26,000 a year, and if you bus that child, it's like $14,000 a year. So you figure it's about $40,000 a year per child for this program. When they start off with a rate, which is called an interim rate, that's a rate that's approved by the state. So, for example, this current school year, which started last July, the rate that they started and they were billing us at was the rate that they last got approved. Since then, they have obviously submitted some costs to the state, and they get 3 times total to come back to the county. The first one is the interim rate, which is the initial rate to start off with. Then the next is the prospective rate, which again they bill us for, and it could be in our favor or in their favor at times because the rates went up or down. And the final is called the reconciliation rate. So the reconciliation rate we just received was just approved December 17th by the state, and it went back to 2015-16. So the reconciliation rate for 15-16 and 16-17 have been finalized. We've gotten the bills for those. Those were over $100,000 that we are going to have to pay to this particular vendor. Then they also, since now that they have another new rate that's been approved, they can now change the rate for the following years, the 17-18, the 18-19, and now our current 1920. So they have backbilled us for all of those numbers, and also with our current year, at least the 2019 portion of it, that was from July to December, we are now getting all those bills. I'm going to make sure they're at the correct current rate. They have one more time in this case, to come back with another rate, and what they're showing, just to give you a rough idea, is that I'm estimating, tuition was about $26,000, it's going up to $31,000. And you talk about rate increase, these all have to go through the state. We cannot pay them unless we find it on the state, and like I said, they just were approved December 17th by the state, and then the vendors are working, or the providers are working on those numbers, send us a bill, whether we owe them or they owe us. In this case, we owe them. So resolution number 18 is basically the total that we're estimating with what I definitely know, and with some that are still going to come, about $670,000. That from 2015-16 school year to current. And we get 59.5% back on that from the state. So we're anticipating about $398,650 we're going to get in revenue. And that's what this is this is trying to amend the 2019 budget, both the revenue and the expense, by just this $398,650. That will be a zero impact to the county on the 19 budget, increased revenue, increased expense. The difference of $271,350 now is up to me to find the money in the 19 budget, just moving between, so we won't not coming back to the county to ask for any more money, and I already have found some of that, so all of that actually. So, which I'll discuss when we talk about the financials, but this is to amend the 19 budget by the $398,650, and just the preschool program.
Supervisor Bruno.
How long does it usually take, or how long do you anticipate being reimbursed by the state?
Well, we usually can bill the first year, like we're in the current school year.
Mm-hmm.
We bill them for July till when we pay, like the end of the year, in March. And we might get that maybe in the summer, maybe in the fall. They have to, by law, pay within a certain time. That first one, it goes up to 15 times, which is over years. That, because you might have a couple kids, you don't have all the information, then you submit it after a certain, with the 15, 16, and I believe the 16, 17, they have ended submitting, but they put a little note except for rate recon. So I really don't know. Whenever we can bill, I do know the current one we'll get within a year.
Okay.
I would assume, since they've done these rate recons and they just approved them, that hopefully that we'll be able to bill those this year in 20 and get reimbursement.
Supervisor Conover, did you have any?
Just trying to understand this. So we received the additional revenue, but that additional revenue is coupled with additional expense as well.
Correct.
And so what you're asking for is to amend the budget to receive the revenue, which was more than what?
We're asking to amend the 19 budget by what we're anticipating for the revenue, replace an equal expense. And we did talk to Ryan about this, and also then that difference is now where we have to go and look into our budget where we have any savings from the 19 year, which I do have, and I will explain in the financials, that can pay for that difference.
So those expenses will be
and
moved to the
we'll
line.
adjust that money, right, so we
with
don't have to go
internal
and ask
transfers.
for any additional funding.
Thank you. Thank you.
It will be all part of our budget.
Supervisor McGowan.
Yeah, I just want to go on the record, I am just so baffled how this system works, and, I mean, how could you actually run a business, but actually coming up with a budget, not even knowing years later what your expenses were supposed to be before? It just baffles me. I just want to, thank you.
The fact that they can come back a total of 3 times, and up to 5 years later, that is the state, right, and it is a mandated service. And, yes, I don't know how other, if they run through the counties, you gotta have that backing. And luckily, we had some savings, so we were able to offset this, so, in that case, I'm glad. We haven't had to come back and ask any money in years. And you're right, when budget in the summer, I have no idea what
So
their
we're
rates-
never gonna question your fluff again, all right?
Well, the thing is, and like I said, their rates have usually been, in this particular case, this particular provider, around 26,000. It's fluctuated a little bit, gone down, so actually where they owed us money, and in the past years, we've gotten credit back the other way, and now it's going back up again. But it's, you know, average is, like, you know, I'm gonna say anywhere from 12 to 22%, you know, you talk about the percentage increases. I mean, to go from 26 to 31, and now that they have that 31, they can now charge that for this current year, because they have an approved rate. So now I have to deal with that with this current budget and starting 20, which...
Are there other providers we can go to? I mean, what's the competition? I mean, like I said, like I said, the whole thing just doesn't make sense. Welcome to government, but, you know, that's just not fair. I don't think it's fair, you know, one, that they can't figure it out, you know, but to have those fluctuations, I mean, Dan just mentioned, maybe this is a business we ought to look into, because that's quite a bonus every year if we, you know, get away with it, right? But thank you very much for really, doing what you can and explaining that, because it just,
Well, it kind of hit us hard, because we've never gotten one where we've gotten so many years of rate recon. Usually, like other providers right now, we have another one that's small, and they went up maybe, you know, whatever, a small amount from 1 year to the next. But again, they're giving us for the 18-19 year. This is going back to 15-16, and we're still approved. We did see, Debbie, who's our preschool program biller, she did see on the site that there was a 14-15 approved, but we haven't gotten anything, so we think maybe they got it to them too late, in our favor. But it started with 15-16, and we were really kind of blindsided when we got all this at once in January. So she's been working hard so I could get to here to get what we needed to get done.
and the percentage from the state doesn't increase at all.
Still 59.5%.
I mean, that was just wishful thinking, I guess,
Yeah.
sorry.
That 59.5% is what we get for the preschool.
That's it.
That's it.
Ryan, were you going to add some clarity to this issue?
I was just going to follow up on Supervisor Conover's question. What we're doing is the state regulates these providers. The state approves the rates. These are all costs that were incurred prior to January 1st, so we need to book them back to 2019. The 2019 budget, the expense authority in this account is $670,000 light. So what we're doing is for the 59.5% that's reimbursed by the state, we're adding both expenses and revenues to increase that expense authority, and then we make up the difference by doing a transfer from other lines out of the public health budget into this line.
Thank you, Ryan. Thank you. Janelle, anything else?
I think that was the big one.
Well, thank you. That was very helpful.
Approval to do that.
Great. You need a resolution to, can we get a resolution to support that? Supervisor Frazier, seconded by Supervisor Conover. All those in favor?
Aye.
As far as referral and pending items, there were none at this time. So moving on for information for discussion and review, I'll turn it back over to Tom for attachments 1 and 2.
Okay, so attachment 1 is our financials. Again, we're still showing you 2019. They're not closed yet. Of course, we don't have much to show you right now for 2020. Again, looking at the whole picture, I know for the new people who are on our committee, one thing is that you say, oh, our expenses are more than our revenues. But like I just stated, especially with the preschool program, we'll be getting those that we can bill, which could be $1 million or so. Probably around March, we'll be working on that and getting those figures in, plus all the billing we have to still do to get to those final numbers. Again, where I talked about savings is this bottom here, our salaries. You'll see that we're 45,586 over last year this time with 2018, and that's due to the regular contract negotiations and increases and stuff. But overall, the savings that we made, we only spent 87.4% of our budget on salaries, so we saved $410,083 in savings in salary. Not that I'm necessarily going to take it from there, but there's the 200 or some odd thousand I need for the preschool program. So I can move it from the savings, from the salary, but, I am looking at other sources if I can before I go to salaries, but either way, the bottom line is I've got the savings that will cover that over, so, again, we don't need to ask the board and anyone for any more funding. Attachment number 2 is just our comparison again for 19, where we, again, 19 is not finalized, and just comparing, at the end of the year where we stand, and, February we'll have a better idea, and definitely by March where the final numbers will be, but, we still have revenues, like I said, to add for that, and our expenses is we've got up to February 14th to get all our expenses in for the year for 19, so we're still working.
Great. Anything else, Janelle?
All right, moving on to status of referrals, so here to review, this is attachment number 3.
Okay, so if you see for November of 2019, our referrals were down -12%, but that was much better than the previous month. We do have off to the side the total number of visits. I guess it's down on the bottom now, 1157. Those numbers, if you look across, just kind of wax and wanes, and it totally depends on, you know, the amount of referrals that we get from the various agencies. More and more of the facilities are sending the people to, you know, rehab centers and stuff like that. And then the other is we had more and more of managed care. And with managed care, those are patients that maybe have regular Medicare, and Medicare really wants their patients in managed care. And so where we've had, you know, before straight Medicare, it's like as long as you can show a need, you can stay involved with the patient and see them as long as they have the need. With more and more managed care coming on board, they direct us, we're going to pay you for this amount of visits. And, you know, there are times where we have to appeal, though, you know, their decision whether they want more, and a lot of times it just depends on who we get on the other end of the phone, you know, the person that's giving the authorization for the visit. So, you know, we know up front, we go out and see a patient, we have to send them all of our information, you know, to their insurance companies, and then they will say, okay, we're going to give you 15 visits. You know, before we used to be able to ask for a full, you know, our orders go for 90 days. We used to be able to ask for that, and now it tends to be, we may, if, for instance, if we ask for 40 visits, they may say, we're giving you 20. And then, you know, we just don't have a choice. You know, we do offer patients a sliding fee scale, you know, if we really feel that it's going to be detrimental, if we just go ahead and, you know, discharge them from home care services. But, you know, we do the best that we can and get through, and, you know, with the mandates that they have on us for all the things that we have to cover, and everybody's being charged in a sense, we want to keep these patients out of the hospital. So, you know, insurances pay less to the hospital, you know, they want, you know, us to hurry up, and we're in a whole new world with, this year, January 1st, started PDGM. That's new to all of the state, and it's going to be, a lot of it is patient-based, patient-driven. What is the patient's goals? And it's going to be interesting to see how that works out, because a lot of times patients' goals aren't what's going to keep them out of the hospital. So they're going to give us, you know, less time, you know, to achieve. But when you can look at it the other side, you know, we can want all the best for these patients, but we do have to have them, like any other, you know, business organization. We have to have their buy-in. So, you know, we, you know, spend the time on the patients that really want to improve, and, you know, hopefully if they say, you know, well, I'm just going to do it my way, and then keep ending up back into the hospital eventually, the hopes would be, you know, listen to us maybe, or hear a little bit of what we have to say and how we can work this out, you know, together.
Thank you. Supervisor McGowan, question?
Yes, no, I just want to say, over the New Year's, my mother, 89, she'll probably shoot me for saying that out loud, kind of wore herself out from Thanksgiving on to Christmas, and that ended up in the hospital. And I have to say, I got the list. We got the list, and of course we called Warren County, and the nurse came over, and on New Year's Day, and he was phenomenal. Really, just put me at ease, and my mother, you know, being a male nurse, was really like just, and the work, everything that went together to pull that together, and the visits, you know, afterwards were just, especially over a busy time. But really also what amazed me is the list of competition you have. And it's awful. And, you know, how can they, you know, these for-profit groups compete? And I know they kind of pick and choose what they want too, and kind of don't go too far out. We have the whole county to take care of. So I think what you're doing is wonderful, and hey, we'll pray on the numbers and just keep up the great work. So thank you.
Thank you. Supervisor Conover.
Yeah, one thing about these numbers in this table that it's very difficult to understand these numbers, because you really have to get behind these numbers in terms of not only the geography of what's been changing, but also the complexity on the visit. I see you shaking your head. Yes, the complexity. So in a way, the numbers we're looking at today is a different world than they were even 4 or 5 years ago, 6 years ago. And so I wonder what the value is of too much of a historical comparison. I mean, it's good to have it. It's good to have those numbers, but I'm not sure we're looking at the correct metrics here. I don't know. I don't have an answer for that. But if you do, you know, I'd be interested in seeing what you think are a more appropriate metric in terms of your visitations and the character of your visitations and the time that you have to spend in each household and the complexity. Because the whole push is to keep people in their household, right? So that means you're dealing with some very needy situations.
In addition, the referral rules have changed, the reimbursement rules have changed, and when a patient comes home, certain diagnosis is required, certain visits, and some are more quick, some are a little longer, and then you've got non-compliance issues or liver health issues, so you're right, there's a lot in the numbers. But I think the initial goal of those is just kind of to track with the competition, what's happening to us. But it is right, you can't just look at the number as a face value, you really have to kind of, and that's part of Val's job, is kind of to understand what's going on in the community and how those numbers reflect and what's creating that. But we typically don't get upset with it as long as we know that it's trending with our other home care agencies in our community, which we hear, you know, talking about the community as well.
And our population is just getting older and older, and it's getting that much more difficult. You know, you can't really, everything is when the person's discharged, who these patients going to be discharged to, so hospital discharges to home care discharges to family, but these family members are also aging, you know, so it's kind of like this vicious cycle.
And technically with this new PDGM, they're expecting us to fix somebody within 30 days, and that's not always possible. But that's where we appreciate the support of the Board of Supervisors, understanding the complexity of the work that we do, and supporting that, because we don't want to discharge somebody just because it's 30 days. We want to discharge them when they're safe.
That's really the point, isn't it, right there? It's the quality of what's needed and the quality of the services being delivered.
And we did just see our quality leader raise up to 4 stars.
Thank you. Supervisor Beatty.
I believe we're the second oldest county in the country. And I want that to kind of sink in. Our average age is that old, the second oldest in the country. So obviously that brings with it a lot more challenges for your department. And I agree with Supervisor Conover, and I'm very pleased to see your quality ratings go up. That tells me there's some real serious caring and attention to these older people. Because let's face it, our neighbors are getting older, we're getting older, but more importantly is the whole county is aging. And that's a serious concern for me, that your department not only stays up with it, but you're almost ahead of the game. And I really appreciate the work that you're doing. know, I thought about the other night, and I'm going, wow, you've got a monumental task in front of you, and it's getting even more difficult, yet you seem to be able to handle it, you ladies and the men in the department. So again, thanks for your efforts. It's really appreciated.
Janelle?
All right, moving along, and thank you all for your support, I do appreciate that. Also included in your agenda packets are the activities for the emergency response and preparedness. We receive grant funding for that every year, and we just try to track our activities, and we share that with you just so you know what we're doing out in the community. We also included the rabies report, which is attachment 5. Our rabies clinic will be starting up in February, so as soon as the clinic schedules up, we'll be posting that on our website, and we'll be distributing that to the town at this meeting. Under informational items, I put in a meeting request to hold the conference and meeting form that was submitted for authorization, and this is a provision to serve a light lunch during our quarterly professional advisory meeting, not to exceed $550 a year. The typical average cost of the meeting is around $125. Many of the people that participate on that committee are volunteer and come and donate their lunch hour to participate in that meeting. So we try to have a light for them, like pizza and salad.
Thank you.
I believe, Amanda, we just have to bring that to this committee.
Yeah, you're the chair on that.
And that's all I have because we've already discussed the food storage.
Do you have something, Doc?
Yeah, I just had a question on the rabies report, and thank you for this.
Oh, sure.
You've got down total bites for the quarter was 46, and I don't know if you track every year and so forth, but is rabies this past year was it more of a challenge? Did we have an increase in rabies bites, or are you seeing a decrease? Or?
About the same.
About the same?
Yes.
Okay, so we're, okay, all right.
We could get the total number.
I'm just wondering if so that there's no alarming increase, it's maintaining pretty much the same rate as we always do. All right, thank you.
We usually have between 250 and 600 a year.
Okay.
Supervisor McGowan?
Oh, yes, is there a reason why we don't like track line too?
Track lines?
Yeah.
We do.
Oh, do we? I'd just be curious, you know, I mean, I can
That will
stop
be
in
in
and
our
see
annual-
that if you have a sheet.
So in our annual report, you'll have the correct numbers. It takes a little bit to catch up to get all the diseases from 2019, because actually if the blood was drawn in 2019, we might still be getting the results. So we'll tally those up in the next month or so.
Oh, all right, yeah, I mean, no,
Yeah.
I was just, for some reason I thought I saw it in a report before, and, you know, like I said, I see the rabies, and actually I'm shocked of, for this quarter, but then yet, we haven't had that many, but, you know, it really hasn't been that cold or snowy, so, yeah.
The dog bites or
Right.
the animal bites? Usually it's much busier in the summertime. In spring starts usually increasing, like April vacation, especially about the warm weather.
Mhm.
Dogs are out, more people have dogs out, so it's a little quieter in the cold. But-
Thank you.
But the numbers for the year stay about the same. Like Janelle said, about 250, 300.
Thank you very much. Are we concluded? Thank you very much, ladies. We appreciate it, okay? You do great work.
Thank you.
Thank you. Thank you very much.
Well, Ron, it's really nice to have you at the table and see you,
I used to be on health, it was one of my favorite committees.
Oh, absolutely.
Very well prepared, one of the best departments.
oh, geez, that's what I wanted to, I really like this new layout she has.
I just said that to her, don't you like the way she changed the format?
Yeah.
Did you just take that out of my mouth, Edna?
No, I already,
Put it
I
back
already
in.
told Ron that before.
Okay, all right.
See, we kicked her to the curb, and now the information flows, you know?
But it's cool, I like that.
Good morning, Deanna. How you doing?
Good, how are you?
Good, thank you.
Go too deep.
Yep,
Oh,
sounds that way,
sorry.
yeah. close.
Oh, hey.
You can be
Give him a big old hug.
Go ahead.
The first item on our agenda is permission to submit our 2020-2024 four-year plan to the New York State Office for the Aging. This plan goes over our goals for the next 4 years and our funding for this year, and it was due on December 13th.
Great. Supervisor McGowan makes the motion, seconded by Supervisor Beatty. Any discussion? All those in favor?
Aye.
Number 2.
For informational purposes, the last 2 pages in the packet, it goes down our funding
Okay, I like
and the
these
maximum
here.
amount that we get for each program, so you guys are aware.
Great.
Item number 2 is permission to amend our New York Connects Memorandum of Understanding between the Warren Hamilton County's Office for the Aging, the Independent Living Center of the Hudson Valley, Warren County Department of Social Services, Hamilton County Department of Social Services, and the Southern Adirondack Independent Living Center. The Independent Living Center of the Hudson Valley no longer subcontracts with the Southern Adirondack Independent Living Center, so we need to amend the MOU to remove them.
Great. Can we get a motion to that effect? Supervisor Conover, seconded by Supervisor Frazier. All those in favor? Great.
And the last item is permission to transfer our district monies into the department so that we can utilize them to cover the salary and fringe expenses for the Aging Services Assistant temp, and 2 computer monitors for the conference rooms that we need. And the position was added at the end of last year, so we didn't include it in our budget.
Great. Motion made Supervisor Conover, seconded by Supervisor Bruno. Any discussion? All those in favor?
Aye.
Under information, we are accepting nominations for our Senior of the Year. They are due February 8th, actually it's February 7th, sorry. The applications, I sent it out to you guys with the minutes, and it's also on our Facebook page. But we nominate 1 senior, or 2 seniors from Hamilton County and 2 from Warren County to go down to the state, and then to also recognize them at our senior luncheon.
Thank you, Deanna.
Our annual evaluation that we typically have completed by the New York State Office for the Aging, they decided not to do it for us this year due to staffing limitations on their end. Just wanted to update you on that. And then we did have our fiscal evaluation completed by NYSOPA on November 7th and 8th. We have not gotten a report yet from that.
Thank you, Deanna. Very good. Any further discussion, privilege of the floor? Seeing none, can I get a motion to adjourn? Supervisor Beatty, second by Supervisor McGowan. All those in favor? Thank you.
Not bad, Peter. Thanks, Dee. Not bad, buddy.
Can't win. Can't win them all.